include computer sound.
Good afternoon, everyone, and thank you for joining us for our 4th Falls Awareness Week webinar, hosted by the Falls Prevention Network and supported by Medline. This session is being recorded. Following our session on post-falls responses yesterday with Julie Windsor and Dr. Julie Whitney, today we'll look at improving post-falls management at a local level. For this session, we're delighted to have Shona MacKinnon, who is a hospital falls coordinator with NHS Greater Glasgow and Clyde. Shona is going to share work on a quality improvement project for post-falls management that she has led across the health board. Shona has been a qualified nurse for 23 years, and patient safety has always been a profound passion for her, with safe footwear, correct bed heights and post-falls management major focuses. Outside of work, she enjoys climbing a Scottish mountain or two, and likes to think of the Outer Hebrides as her hometown. So everyone will be on mute throughout the session, just a few housekeeping pieces on mute throughout the session. So please just, as you have questions that come to mind, just put them into the Q&A panel at the top of your screen, and we'll come to them with Shona at the end. Okay, right, I'm going to hand over to you now, Shona. So I will put you on the screen with your slides. There we go. Right, over to you, Shona.
Thank you. Welcome everybody, and thank you for the introduction, Simon. Thank you to Audrey Neal, all at UK Falls Network and Medline for this opportunity. Today I'm going to present to you our Improving Post-Fall Management project. So NHS Greater Glasgow and Clyde is one of the largest health boards in Scotland, serving 1.3 million people. So it's just a small population, really. The role of the Hospital Falls Coordinator. Next week sees my 4th year as a Hospital Falls Coordinator within Greater Glasgow and Clyde. There's 6 of us in total, 2 for the North sector, 2 for South sector and 1 for mental health, myself covering 47 wards in Clyde sector. We are led by Laura Halcrow, who is the Acute Falls Prevention Lead for Glasgow. The Hospital Falls Coordinators provide specialist clinical input into the wards and other areas, promoting best practice in the reduction of inpatient falls and the implementation of evidence-based interventions within a hospital setting. We carry out multifactorial inpatient assessments to reduce falls. We also support staff in the implementation of the falls risk assessment reduction tools and interventions through a planned teaching strategy. If a patient does come to harm from an inpatient fall, either sustaining a fracture or a head injury, we would complete a severity 4-5 harm review. The terminology severity 4-5 simply comes from how we score the severity of the injury sustained on our incident recording system. Our harm review process looks at 27 different factors of the circumstances around the patient pre and post fall, and includes a summary of the patient's hospital journey. A decision is made if the fall was avoidable or unavoidable, and this is an agreement with fellow Hospital Falls coordinators, the senior charge nurse of the ward where the fall occurred, and the lead nurse for that area. A final report is then sent to all managers for the area, the chief nurse and our health and safety team. The main focus of these themes is to learn from the falls with harm and reduce common themes from reoccurring, and then hopefully reducing further falls with harm. We collect data around the common learning themes from all falls with harm across Greater Glasgow and Clyde. Issues in post-fall management seem to be a consistent theme and led to the identification of post-fall issues coming third in our top learning themes. This made up 13%. One key element identified was post-fall moving and handling. In Scotland, we do not participate in the national audit for inpatient falls. However, the key performance indicators are consistent with our local review process. Studying their annual report for 2022 and focusing on our post-fall management learning themes, best practice actions taken immediately post-inpatient fall can lead to better outcomes and experiences for the patient. In particular, a thorough top-to-toe assessment prior to moving the patient, and if a hip fracture or injury was suspected, then specialist flat lifting equipment should be utilised to safely move the patient. In Scotland, we do work towards Health Improvement Scotland and the Scottish Patient Safety Programme for the acute adult. It's called SPSP for short. SPSP is a national programme to reduce harm and enhance the experience and outcomes for people in acute care, where reducing falls and falls with harm have been identified as a priority. SPSP work in partnership with Scotland's NHS boards, the Scottish Government and Health Improvement Scotland colleagues to support the implementation and spread of the Falls Change Package, which we use to support our quality improvement methods to improve falls reduction within Greater Glasgow and Clyde, taking primary and secondary drivers along with the change ideas and producing local quality improvement projects. So for this project, we have taken person-centred care as our primary driver in reducing falls, our secondary driver being regular review, and our change idea is post-fall review. So our aim was to devise a poster resource to improve post-fall management within NHS Greater Glasgow and Clyde, in particular using flat lifting equipment. And this would enhance the patient outcomes and experiences. Due to multiple factors identified, we involve other members of the MDT. We then pulled together a short life working group with representatives from our moving and handling team, physiotherapy and our practice education team. Initial brainstorming identified that an algorithm-based poster would be the most effective resource for inpatient areas, with clinical simulation being a contemporary method of delivering healthcare education. We arranged for the medical illustrations team to film us demonstrating post-fall moving and handling. We did produce 2 videos, which I will show you later on in the presentation. We then applied the videos to the poster using QR codes. And we also, within our area, some of our wards use a blue post-fall checklist sticker. This was a QI project produced locally. However, I had identified that it was slightly out of date, and that was simply due to continuous changes within the board and moving with the times. Our north sector in Glasgow also had a local post-fall sticker, and again, it was slightly dated. We managed to obtain ownership of both these stickers and use learning from falls with harm to renew and upgrade both the stickers to one universal post-fall checklist sticker that would be used board-wide. So here we have Greater Glasgow and Clyde's post-fall guidance poster. It has been designed as a one-stop shop for post-fall management. It does specifically record "do not move the patient" and then signpost to carry out a top-to-toe assessment, listing potential injuries that have been sustained or could be sustained. It has a body chart on the opposite side with common injuries from falls and some things to look out for. We also made these colour-coded for easy viewing. The poster also incorporates to consider pain relief for the patient prior to moving them. We have a post-fall checklist to guide all ward staff, and there is also space in the bottom corner for each individual area to record where their nearest flat lifting equipment can be located. And of course, you can see down at the bottom, we have our QR codes to the post-fall simulation videos. And these are available for staff to be able just to scan and learn at any time, hopefully before a fall. Also on the opposite side, we included what a severity 4-5 harm is and when to appropriately refer to the hospital falls team. The development of the poster hasn't come without its delays or barriers. It has been approximately 18 months in the making. Some barriers included COVID-19 pandemic, the approval process, governance processes, feedback, multiple edits, and also discussions around neuro-ob guidelines. Now let me introduce you to Mrs. Mack. The next 2 slides will show our post-fall videos. The first one lasts approximately 3 minutes. Oh, Mrs. Mack. Oh no, what's happened?
Just failing yourself. I went to stand up and the table moved away. It was
Right.
the table that moved away.
Oh, right, okay. Have you hurt yourself?
think I've just got a wee craze in my knee.
Your knee sore? Okay, what about your head?
No, it's okay, I think.
Right,
Like
okay.
my cheek or something, but I'm fine. I feel stupid.
No, it's all right. You're okay. We're going to get you up, all right, once I've had the wee check over. Have you, did you feel dizzy at all?
No,
No, not feeling lightheaded when you fell? Right,
I just went to
okay.
stand up the table went away.
Right, okay, so we're just going to get the space cleared a little bit and check you over. All right, could I have some help in here, please? Hi, Maureen. I know Mrs. Max had a wee fall. Could you move the bed and things out the way? I'm just going to give her a check over. It's Maureen, the other nurse, okay? Any sore bits along here?
No,
And down here?
Yeah.
Okay.
Yeah.
You hurt your wrist? What about this bit? Is this sore here?
No.
What about your other hip that you're lying on there?
Okay.
It's all right? And these legs?
I think I might have graze in my knee, Shona.
This one? This one? That one? All right. What about any sore bits down this way? You point your toes away, you can wiggle them? That's fine, okay. Just stay where you are a minute. What we're just going to do is get you round onto your back, nice and slowly. Maureen will give me a wee hand, okay? And we'll have a wee check down your front, okay? So if you pop this hand up and kind of under you, and then Maureen's behind you, so we'll just slide you over, okay? That's you. All right, when you're ready, if you just straighten those legs, straighten them both out, point your toes up. Yeah, I think we'll get her up onto the chair. If you're going to manage that, we'll give you a wee hand, tell you what to do. That's fine. Are you able to get the chair, Maureen, in position? We'll just stay where you are. We'll get you up on the chair and we'll get your blood pressure and things checked, okay? Okay, you're all right. You've got a wee graze on your head there.
So I don't know, it's my knees there.
Get that. We'll get a look at that and get some ice on it for you. Okay, you're all right. Okay, you just bring your knees up for me, Mrs. Mack. Can you manage that? I know that one's a bit delicate. Okay.
Okay. Yeah, so can you look the way over there and just bring that arm all the way over?
We're going to go onto all fours here.
And can you just try and lift your head up for me? That's it. You feel okay? You're not too dizzy? Good. Try and push up.
Onto all fours.
Yeah, that's you. Bring yourself down. That's it. And if you like it, you can move to the chair.
We'll just support you.
Oh, that makes stinging.
Oh, we'll get a wee look at that for you. And that's you. Okay, how's your head feel now?
Oh, I feel.
How's your head now?
Oh, it's feeling nice, fine, Shona, yeah.
All right.
I just feel
No, you're okay. We're going to get you a wee glass of water and I'll check your blood pressure, okay? Okay. Thank you. As you can see, we have aged these videos by wearing masks. However, they were filmed last summer when it was a clinical requirement. Excuse me. We have added subtitles to our videos for ease of learning, and editing these alone was a timely process, but very worthwhile. So now I shall play our second video. And this one is demonstrating flat lifting equipment. It is a little bit longer. It's approximately 10 minutes for this one. Oh, Mrs. Mack. Oh no, what's happened?
just fallen there. So I went to stand up and the table moved away.
Right.
The table moved away.
Oh, right, okay. Have you hurt yourself?
I think I've just got a wee graze in my knee.
Your knee sore? Okay, what about your head?
No, it's okay, I think.
Right, okay.
My cheek or something, but I'm fine. I feel stupid.
No, it's all right. You're okay. We're going to get you up, all right, once I've had the wee check over. Have you, did you feel dizzy at all?
No.
No, not feeling lightheaded when you fell? Right,
I just went to
okay.
stand up the table went away.
Right, okay, so we're just going to get the space cleared a little bit and check you over. All right, could I have some help in here, please? Hi, Maureen. I know Mrs. Max had a wee fall. Could you move the bed and things out the way? I'm just going to give her a check over. It's Maureen, the other nurse, okay? Any sore bits along here?
No.
And down here?
Yeah.
Okay. You hurt your wrist? What about this bit? Is this sore here?
No.
What about your other hip that you're lying on there? It's all right? And these legs?
I think I might have graze in my knee, Shona.
This one? That one? All right. What about any sore bits down this way? You point your toes away, you can wiggle them? That's fine, okay. Just stay where you are a minute. What we're just going to do is get you round onto your back, nice and slowly. Maureen will give me a wee hand, okay? And we'll have a wee check down your front, okay? So if you pop this hand up and kind of under you, and then Maureen's behind you, so we'll just slide you over, okay? That's you. All right, Mrs. Matt, I think you've got a really sore leg, possibly fractured your hip.
That's really slow.
Okay. Maureen, if you wouldn't mind, could you go and get the hover jack for me, please, and bring some bodies back with you to help? Is that okay? And you're just going to lie there nice and still for us, okay? Going to get some special equipment that's just going to get you up into bed. Do you think you need any painkiller?
I think I need something. Just really slow.
Okay. I'm going to check your blood pressure, all right, and we'll get you some pain relief as well. Okay. Okay. And just pop your sleeve up for us there. Thank you. I'll manage that. You've got a bit graze there. Do you want a wee pillow under your head there, Mrs. Mack, just to get you comfortable? It's going to take us a wee minute to set this up. I know. Excellent. Nice and relaxed. Put your finger in there and just relax. Let me pop that onto your head. Lift your head for me a second.
Thank you.
Oh, there you go. Thank you very much. Okay, I'm going to sit you up a wee bit just to give you a wee. Okay, manage
That's
that.
them,
I'll
I'll
give that to you, Laura. Thank you. Just waiting on this blood pressure coming. Okay. We are going to have to roll you onto that sore side just to get you onto this mattress here.
Do you need to?
You'll be all right.
Thank you. I'm awfully sorry, girl. She's awfully busy.
Not at all. You're fine. It's just taking a wee minute to get your blood pressure. I think you've just had a fright. That's perfect. Okay, everybody?
Yep.
Okay. Pop your arm across this chest. You want to be pillow in between your leg there? Thank you. Okay. I'm just gently going to come over on your side onto that sore leg. Over to me. And over. You're all right. And we'll get you some stronger pain relief when we get you into bed. And just relax. That arm across that chest there, Mrs. Mack. Over to Maureen. And just relax your arms across your chest. Thank you. Okay. This is a wee bit noisy, this equipment, when we start blowing it up, but it is the best way to get you into bed.
Do I need to phone my son?
No, we'll give him a wee phone, it's all
Are
right.
you sure?
Will he be at work just now?
Yes.
Yeah, I'll pop that down
I
for
think
you.
he's doing that working from home thing.
All right, okay. We'll get him. How's your head feeling?
It's that wee graze. That wee graze, I
We'll
think.
get the doctor to check that out for you. Okay,
I'm really silly.
it's all right. It's just us that's in here. Can we down to help you? No, that's fine, thank you.
Shona, I take it this means I'm moving home.
Not today, Mrs. Mack, no. The doctors will get a look at you once you're in bed.
And you'll be able to help me.
Yep. So this one's going to blow up, okay, like an airbed. Okay, ready, steady, move. And ready, steady, move. That's it. Okay. Thank you.
You're right, that was looking noisy.
And it's going to be noisy again, I'm afraid, okay? We're going to go up to about level with your bed.
I just, my foot. Oh.
Okay.
I'm going to
One more to go and you're getting up higher. Well done. Now what we need to do is we're going to need to get you spun round just so that you're the same way as your bed, all right? Are you able to get that? Yeah. Everybody? Okay, so we're going to go round that way?
Okay.
Okay, ready, steady, move. And we can just bring that bed out from the wall a wee fraction, that'd be good. Okay. You want that round that side, Maureen?
I'll put that in there and maybe bring that out.
So all we're going to do now is we are going to transfer you straight over onto your bed, and then there's no more moving, okay, apart from to get you off this cover. Ready, steady, up, move. Steady, steady, move. Thank you. Did that work or no? Okay, so we're going to this sore hip, all right? Should we come to us? Okay, if you bend up your good leg, Mrs. Mac, just bend it, dig your heel in, and over you come towards me. Ah, no, darling, that's you. And round you go, back onto your back. Wee bump underneath you, and now you're going over to Maureen and Julian. Shoot. We're going to get the doctor to come and see you, okay? Do you want another pillow? Are you okay? Another one there. You're awful warm. Let me get you some more water. Just get the bed down. Would you like to sit up a little bit? Okay. Okay, Mrs. Mac, I'm just going to shine this torch into your eyes. I'm just checking to make sure you haven't seriously hurt your head when you fell, all right? So if you just look straight ahead for me and just open your eyes. Okay, and this one, and look straight ahead. That's fine. That all looks okay. I'm going to go and phone your son now, all right? No problem. Oh, you're absolutely fine.
I'm really sorry.
No, don't apologise. Okay, fine. Doctor will be along shortly.
Thank you.
Thanks everybody for taking the time to watch our videos. Just to say, our medical illustrations team were a fabulous team to work with. They've also broken the videos down into multiple sections that we can use for all aspects of falls training going forward. These include effective communication within the team and with the patient, better experience and outcomes for the patient, demonstrating leadership when an incident does occur, and best practice moving and handling techniques. Here we have our post-fall checklist sticker, which actually has been recently rolled out and is already proving effective in the management of the post-fall patient. It also triggers an appropriate referral to the hospital falls team, where early interventions can be implemented and reduce further falls. It includes what moving and handling equipment was used after the fall, also other factors such as bed rail status and the bed height at the time of the fall, footwear and walking aids used if applicable. This catches the information in real time, prompts for learning going forward, and is resourceful if an investigation was to be raised at a later date. So the next steps for us are to get the poster rolled out to all wards and areas across Greater Glasgow and Clyde. We are hoping that is going to be the end of this month. Going to gather the data on the effectiveness of the post-fall resource, poster, videos and the sticker. And our poster guidance does form part of the new inpatient falls guidelines, which will be issued within Greater Glasgow and Clyde. And lastly, we plan to review our post-fall medical review tool. So I've really enjoyed working on this project and I've actually learned so much myself. It wouldn't have been achievable without the expertise and knowledge of our Short Life Working Group and our falls team. So special thanks goes to Elizabeth Simpson, so is also known as Mrs. Mac. Liz was one of our practice educators for older people and stroke wards in Clyde sector. She has now moved on and is sharing her expert knowledge elsewhere. I do wish her well, but her legacy will live on in Greater Glasgow and Clyde now. Thank you to our moving and handling team, Gillian MacDonald, who is lead moving and handling practitioner for Greater Glasgow and Clyde, and Maureen Nugent, who is our moving and handling practitioner here in Clyde sector. Another red carpet candidate is my boss and acute falls prevention lead for Greater Glasgow and Clyde, Laura Halcrow. Laura's background is physiotherapy and she is also a wealth of knowledge in falls. She's been a huge resource for this project from start to finish, coordinating all the meetings, the review processes, the governing, the editing, the printing and the communication to get this rolled out. I'd also like to thank my falls coordinator colleagues in the North and South sector. So I've got Susan and Alison and Elaine and Lindsay for their valuable input and multiple reviews and continued support. And lastly, a huge thanks to our medical illustrations team who did all the filming, the subtitles, the editing, and who have the patience of a saint. Thank you for listening and happy falls team to everyone who has tuned in. Does anybody have any questions?
Thanks, Shona. That was brilliant and a great example of quality improvement program or project, around post-falls management and picking up on a lot of the themes that we actually discussed yesterday with Julie Windsor and Julie Whitney. I know one of the questions for Julie Whitney was, do RCP do a video on post-falls management? So I think we've got, I'm sure we're going to get plenty of people wanting to borrow your video because I think they're brilliant. And like you say, you've broken them, the 10-minute one down into the smaller sections. So we've got a question in from Tina. Have teams looked at data including time of day when the falls happen in settings? Are there any patterns relating to factors like the number of staff when those falls happen and patient cognition behaviour?
Yeah, so we have been in touch with our instant recording team and we can easily access a dashboard to see when the time of falls, if there's any pattern to that. For staffing on an individual fall with harm basis, we don't look at what the circumstances were going on in the ward at that time, but we do look at the patient, everything surrounding that patient. If it was to go on for a further discussion, that is something that absolutely would be looked at the time. And yes, within our 4-5 falls review, we do look at cognition and certainly was a new or acute confusion picked up. And on the poster, you'll also see there is a yellow triangle to alert staff that if there was a potential head injury, if the fall was unwitnessed, and there was a cognitive impairment, that we are looking at, are we possibly going to have to carry out a CT head, etc., obviously based on the post-fall medical review. But yeah, we do look at all that data. Thank you. Brilliant.
Okay, hang on, I've got another one coming in. Oh, there we go. If you got it, yeah. So do you use, I'm not saying this right, SIPES, so SEIPS, to explore falls and look at trends or thematic analysis?
I've never heard of that, so it's possibly different in Scotland, but yes, we definitely do follow trends, and we work to a medium line of trying to reduce the falls and falls with harm. But if anybody wants any further information on this, if they want to drop their email into the chat box, I can discuss it with our lead, Laura Halcrow. Thank you.
Yeah. No, and if anyone does drop their email into the Q&A, don't worry, we won't publish. Obviously, the Q&As, we won't publish those when the recording goes out. So yeah, we'll just use it for the purposes of getting in touch with Shona. Okay, all right. Neil's just put an explanation up on the SIPES. SIPES is a framework for understanding the outcomes within complex socio-technical systems. Figure 1 provides an overview of the system engineering imitative for patient safety framework. There we are.
Okay.
So I guess there's one I'm sure other people will have questions in a minute. One question, I think it's an NHS England framework. So one question for me, and again, it sort of came up on the webinar yesterday as well, was, are there sort of challenges in getting hold of? So you have the example there of the hoverjack. Getting access to the equipment when you need it. Are there challenges there? And if there are challenges, what have you been able to do to overcome those?
So yeah, we are quite limited on the equipment, sadly, around all sites. But we do, staff and wards do know where to be able to locate it. We have come across barriers where equipment has been broken and obviously had to wait for the company to come out and fix that. And it's just making sure staff know where the next available equipment is that they can get their hands on. It is a timely process. It generally happens on night shift when staff's numbers are slightly reduced as well. We have, at some wards, will ask the portering team to maybe just go and get it for them, just to make sure there's not that many members of staff leaving the ward at any one time. But it's just trying to encourage that. Do not move the patient. The patient can't fall any further. If we can just make sure that, make the patient comfortable on the level that they're on after the fall till we get the appropriate equipment in place. We are hoping to get some funding to get some more flat lifting equipment in the future. So hopefully these videos will help push that on as well.
Great, thanks, Shona. Thinking about the outcomes of this for staff, how has the confidence of staff and the competence been impacted by the use of the videos? Really good question.
So I think we've already been using the videos in training and actually getting moving and handling coming along to event days that the Falls team have been hosting, and staff have found it really useful. Everybody should have had their basic moving and handling training when they come to Greater Glasgow and Clyde anyway, and it's a 2-day training session and the hoverjack is part of that 2-day training. But just getting that recap from us is they just find, so resourceful. We them to have a go and demonstrate it, but we also having these videos is just bringing it to the forefront of their mind again and recapping. I think it's one of these bits of equipment that's a bit daunting. I'm an orthopaedic nurse from my background, so we used it very regularly and could basically use it with our eyes shut. But I think for some of the ward staff who don't come across this type of equipment, often it can be quite daunting. So having the videos there to be able to watch and learn before an incident does occur, it does make such good learning and hopefully better experiences for the patient.
Yeah, I think that's great, and I think the obvious question as a follow-up to that around the competence of staff and the training, and now that the staff have greater awareness of how to respond to falls and the causes, has it reduced falls incidents? Well,
the poster has yet to be rolled out, so that's coming. The sticker has been rolled out, and because there is a question on there that does alert staff to refer to the falls team, we are sort of getting in there a bit quicker than, some may not have thought to refer at that point. But the falls team are able to get in there a bit earlier and make sure that there's plenty of safety interventions in place. So yes, is the answer to that. The sticker is working, and I am sure the poster will have a really good effect as well. Thank you.
Brilliant. Okay, I think that's, unless there's any final questions that anyone's got, I think we can wrap it up. So yeah, massive thank you to you, Shona. I know it's not easy doing these things, and it was a really good session, really clear. And yeah, if you're okay to share the slides as well, we'll put it out on the Falls Practitioner Network as well. And yeah, just a massive thank you to you. Great projects, and obviously the more of these types of projects that we can share through Falls Awareness Week and just through the Falls Prevention Network generally, I think it's benefit to everyone. Oh,
Sorry,
hang on,
man.
we might have got a last minute.
It's Tina just saying, has the feed frozen? Can't hear anything. Not mute.
Not from our side, but
Sorry, Tina.
yeah, I'm not sure if anyone else is getting that issue, but yeah, I think we're about done anyway. So yeah, thank you very much, everyone, and hopefully you can join us again for our final Falls Awareness Week webinar tomorrow with Tara Marshall on free falling, looking at free algorithms sort of around patient, sort of patients with long lies, and yeah, so it's really good. I think Tara will look at all the options available. Obviously she's got years of experience, and I think will give a really good independent assessment of the tools that are out there, and so hopefully you can join us for that. Okay, thanks everyone.
Thank you.
Thank you.